Health and social care organizations have a duty of care towards the people they look after. That means care practitioners must do everything they can to keep the people in their care safe from harm. Duty of care includes working to the values of adult social care, working in a way that keeps people safe from harm, and treating individuals with respect and dignity. When individuals receive care and support, care practitioners must treat them with respect and dignity. This includes treating individuals in a caring and compassionate way and treating others how you would want your loved ones to be treated. Respect means believing and showing an individual that they are important and respecting their feelings and opinions, even if you don't agree with them. Dignity means treating somebody with respect, valuing their individuality and their ethical and moral beliefs. Privacy means giving individuals space as and when they need it and protecting their personal information. Care practitioners can show someone they respect them by treating them as equals, making sure they have privacy as and when they need it, ensuring they are never neglected or left in an undignified situation, taking an interest in their life story, listening to them, and taking time to get to know them, respecting their personal preferences, lifestyle, and care choices, and not imposing our own beliefs and opinions on them, supporting them to live as independently as possible, be as involved in the community as they want, and respecting their choices and decisions. Taking every reasonable effort to comply with their preferences and requests for who delivers their care and support, such as a woman requesting a female carer to support them with a personal care task. And communicating in a respectful way, that is, using their preferred communication style, understanding that they might not want to engage in conversation sometimes, and addressing them in their preferred way, hello Professor Al-Saleh, rather than hello Rushdie. Care practitioners need to respect the right of the individual to privacy when they need it, and their right to a private life. The Social Care Institute for Excellence defines privacy as the right to keep important parts of yourself to yourself. Care practitioners can ensure the privacy of an individual by having discussions about care and support in places where it can't be easily overheard, making sure their privacy is respected when they are asleep, unconscious, or lack capacity, making sure confidential information is kept safe and secure, and no sensitive personal information is shared inappropriately, making sure they aren't sleeping in accommodation with members of the opposite sex, and being able to use gender-specific bathrooms. Taking steps to ensure any surveillance used is in the best interests of the individuals using the service and complies with current guidance. Supporting them with personal care needs, if required, in a private room, and making sure no one will enter or disturb them when washing, bathing, using the toilet, or having private conversations and moments with loved ones. And asking them for their preferences when it comes to privacy. For example, do they want you to leave the room when they have visitors, and ask other staff not to disturb them, as far as reasonably practical? Practitioners need to support people to live as independently as possible and encourage them to make their own decisions. There will be times, though, when practitioners face a dilemma between supporting independence and keeping someone safe. For example, a care home resident who wants to continue smoking. In these situations, it's important to ask yourself, if we stop them doing it, are we denying them the right to take risks and make their own choices? If we let them do something dangerous, are we failing in our duty of care? It can be difficult to manage dilemmas, but practitioners should focus on social care values, positive risk-taking and risk management when making tough decisions and resolving dilemmas. It may also be necessary to seek advice from managers or other professionals, such as a GP, about whether the consequences of the decision will restrict rights and freedoms and/or put others in significant danger. In the example of the resident of the carer home who wants to continue smoking, the practitioner needs to ensure that they have the capacity to make the decision, are making an informed decision and have been advised on the risks by a healthcare professional, are not putting others in significant danger by wanting to smoke around other residents and care workers. If all of the above is in order, then it would be inappropriate to stop the individual from smoking when they join the care home. It is an individual's right to make an informed decision to continue to smoke when in care, and it is the responsibility of the care home and workers to put measures in place to ensure they do not put others at risk. This could be designated smoking rooms or outdoor areas and necessary fire safety precautions.